Hi everyone, this is Dr. Salemy, and today we're going to talk about the differences between a breast augmentation and a breast lift. Oftentimes I get patients coming in to see me and they're kind of wondering what's going to be the best option for them. So I just want to go through some basics. If you come to see me for a consult, you may hear me say this because I use this a lot when I talk to my patients, and that is that if a patient comes in and loves the way their breast looks but just wants to be fuller, typically we're talking about a breast implant in that situation. But if a patient comes in and they like the size of their breast, they don't want to be any bigger, but they want the shape better, they want it lifted or maybe made a bit more round or more youthful, then we're talking about a breast lift. And then sometimes we're talking about both. Some patients want or need both, and that's a separate topic, and we discuss that with patients if that's what they're looking for. And then we decide, can we do those two surgeries together, or do we need to divide them into two surgeries? And that really depends on a lot of factors. In general, when we're talking about breast augmentation, we're talking about breast implants. There's a lot of good options for patients. There's saline implants, there's silicone implants, there's smooth surfaced implants, there's textured implants, there's round, and there's anatomic. This is a really common one we use, a smooth, round, gummy bear silicone implant. But there's a lot of different choices, and we'll go over them with you. We also talk about the sizes of the implants, the profiles of the implant. Patients ask us a lot about that. A profile basically just means how wide an implant is compared to how projected it is, how far it comes off your chest. So we talk about those choices. We talk about incision options, and we talk about the pocket. Do we go behind your muscle or in front of your muscle? So those are kind of the basics that we review, and then we put a plan together based on what you want, your anatomy, and what we think we can accomplish. In terms of a breast lift, what I tell patients is, if you imagine your breast is a cone and the base of the cone is sitting on a fixed position on your chest and the nipple is the top of the cone, oftentimes when patients come to see me, the breast tissue and nipple have dropped. The base stays where it is, but they've dropped. And that can happen with weight loss, it can happen with pregnancy, breastfeeding, time, age, gravity. And so when we're doing a breast lift, what we're trying to do is take that breast tissue and elevate it and center it back on the base. What we can't do is take that base and move it. We can't move the base up or out or in. That base is a fixed position. And in order to do a breast lift, what we're doing is making incisions on both breasts in an anchor pattern. So that's an incision around the areola, and if the areola has widened, we can make it smaller. An incision down the breast and an incision underneath the breast. And those incisions allow us to do the surgery to lift and reshape the breast and get some more symmetry if we need to, things like that. So that's kind of the general overview of the two operations, and when we see you in person, we can decide what's going to work best for you. Thanks so much.